CMV, or cytomegalovirus, spreads quietly and efficiently, often without any obvious symptoms. It passes from person to person through direct contact with infected bodily fluids. Saliva, urine, blood, tears, semen, and breast milk are all potential carriers. Because the virus is so stealthy, most people don't even realize they've been exposed or infected. Everyday actions like sharing utensils, drinking from the same glass, or kissing a loved one can transmit the virus. Even simple gestures of affection or care can be enough, which is why CMV is extremely common and often goes unnoticed. By the age of 40, over half of adults in the United States have already been infected with CMV. In some parts of the world, especially where people live in close quarters or have limited access to hygiene resources, infection rates are even higher, sometimes nearly universal. Once you've been infected, CMV remains in your body for life. Most of the time it stays dormant and causes no harm, blending into the background of your everyday health. Young children, especially those in daycare or preschool, are frequent sources of CMV. They can shed the virus in their saliva and urine for months or even years after their initial infection, making them a key part of how the virus spreads in communities. Hands-on care, like changing diapers, wiping noses, or cleaning up after children, increases the risk of exposure. This is especially important for pregnant women who may be more vulnerable to the effects of CMV. For anyone with young children at home, or those who work with toddlers in schools or daycare centers, understanding these risks is crucial for protecting themselves and their families. Learning about how CMV is transmitted is the first step in prevention. With the right information, you can take practical steps to reduce your risk. It's not about avoiding loved ones or changing your life dramatically, but about being mindful of how CMV can spread in everyday situations. For pregnant women, this common virus requires extra caution, since CMV can sometimes cause complications during pregnancy. Recognizing the small risks in daily routines, like sharing food, drinks, or close contact, empowers you to make simple changes that can help protect both you and your baby. Even small steps like increased awareness and a few mindful habits can make a big difference in reducing the risk of CMV. Prevention truly starts with understanding how CMV moves through our lives and taking action to protect ourselves and those we care about. CMV is often silent in healthy adults. Most people never know they've had it. If symptoms do appear, they're mild and mimic common illnesses: fatigue, low fever, sore throat, muscle aches. Many dismiss these as a cold or flu, never realizing it's CMV. For pregnant women, this lack of clear symptoms is a problem. An infection can go completely unnoticed. Fatigue or minor illness may be attributed to pregnancy, not a virus. Without obvious signs, there's rarely a reason to test for CMV. Yet, the period of active infection is when the virus can be passed to the fetus. That's why awareness is crucial. Even mild, unexplained symptoms during pregnancy should be discussed with your doctor. Open dialogue helps ensure the right testing and care if needed.